Do you know what's happening in these two tubes in the right? It's showcasing some sort of platelet formation. My name's Dr. Anthony Wheeler, and I'm going to tell you everything that you need to know about pathology. We'll talk a bit more specifically about what's occurring in these tubes. But before we do that, make sure you have your books handy. This is going to be a short lecture. It's a general overview. I'm going to only touch upon a couple points. And there are 2 additional lectures, at least, that are going to dive into more detail for these. So in general, high-level overview, what is hemostasis? Hemostasis is the body's natural response to an injury that stops the bleeding and fixes the damage. That's what hemostasis is. Now, I'm sure that you know, blood must be able to flow freely through blood vessels in order to reach tissues, right? If that doesn't happen, ischemia occurs, lack of oxygen, lack of ATP generation, necrosis, etc. It's not good when oxygen can't reach its endpoint destinations. Hemostasis, which involves the creation of a thrombus, clot, at the site of a vascular injury, repairs damage to the wall. Now, this is the big take-home message. If you got this, 100% for this presentation. There are 2 phases of hemostasis. It's real easy. Primary hemostasis and secondary hemostasis. Here's this image again. There's an aspect of hemostasis occurring in this test. The vial on the left shows a somewhat beigeish yellow fluid. And on the one on the right, you see these fragments, this clumping that's taking place. See, the only difference between these 2 tubes is that the one on the right, ADP was added, and that activates the platelets. And then you have this clumping forming. That's what's going on. So it's showing that, hey, the platelets at least aggregate with the addition of ADP. Let's hit this message about primary hemostasis. With primary hemostasis, you must know this. With primary hemostasis, that forms a platelet plug. That's the whole point of primary hemostasis. If you remember that, you're golden. Primary hemostasis forms a platelet plug. You can see primary hemostasis pathology, the lecture or the chapter of the book, for further detail. It'll probably be linked around somewhere, so it's easy for you to navigate to. Primary hemostasis is caused by interactions between platelets and endothelial cells lining the vessel wall. Okay? So keep in mind, primary hemostasis forms a platelet plug. You'll highly likely be asked that. Here are 3 cartoons outlining primarily the coagulation cascade. Now, this is something that you're going to need to know like the back of your hand. These look somewhat complicated. You know what I'm going to do? I'm going to create a very short, easy to remember coagulation cascade. I could probably do it in a minute, maybe even 30 seconds. There's a challenge right there. I'll create that and I will link it somewhere so it's easy for you to find. And that way you'll have rapid memorization skills for the coagulation cascade, at least the important things that you need to know from it. But off the top of my head, the common pathway for that, you need to know 10, 5, 2, 1. And then for the extrinsic pathway, that involves 7. And there's other little mental tricks that you can use to remember the intrinsic pathway. But if you remember 12, 11, then you skip 10, 9, 8, something like that. It's really easy. I'm going to put something together for you guys, and I'll link it. That way we'll ensure your success, right? Because I want to see you guys win. Okay, moving on to secondary hemostasis. Secondary hemostasis stabilizes the platelet plug. Secondary hemostasis stabilizes. That's another thing that you will be asked. Secondary hemostasis is mediated by the coagulation cascade. And there's another lecture that goes into this in detail. Again, I will link that, make it easy for you to navigate to. We'll find it, we'll do it together. And this is a short one, but the key take-home points, I hope that they're stuck, anchored in your mind, right? Primary hemostasis for the platelet plug. Secondary hemostasis for stabilization via the coagulation cascade, right? If you know that, A+ for you on this, and I will see you on the next one. Take care.